Hi there, welcome to Hersco Online, where we have short educational videos that look at tips and tricks for dispensing custom foot orthotics, custom molded shoes, and AFOs. In this session, we're going to look at the term Mortons as it relates to foot orthotics. There were two Mortons in the podiatric field. In this case, we're going to look at Dudley J. Morton and Morton's syndrome. Morton's syndrome is typically characterized by a short first metatarsal, meaning that more weight is transferred and borne by the second metatarsal, and it leads to pain at the metatarsal heads and at the base of the metatarsal also. Conservative treatment of Morton's syndrome consists of building a flexible platform underneath the first toe and the hallux. By bringing the ground up to the first met, the toe is assuming extra weight. The addition of a flexible material and extension into the forefoot of the orthotic is known as a flexible Morton's extension. The flexible extension can be made out of cork, EVA, or any other suitable material, usually 1/8 to 1/4 inch in thickness. The goal of the flexible Morton's extension is to bring the ground up and increase the weight bearing along the first MPJ. However, there are other conditions that require limiting motion at the first MPJ. For example, hallux limitus or even hallux rigidus. In this case, the idea is to limit the motion by putting something into the shoe, a stiffener of some sort. If this is not done, the patient tends to compensate and avoid weight bearing on the medial side of the foot during toe off. A rigid Morton's extension is a foot orthotic where the plastic is extended beyond the metatarsal heads, and it limits motion inside the shoe and reduces range of motion of the forefoot. Sometimes the addition of a rigid Morton's extension to a foot orthotic can exacerbate the condition if it doesn't fully limit range of motion. In those cases, it may be preferable to stiffen the shoe. In the old days, they used to add steel shanks to the midsole of the shoe, and that would certainly make the shoe more rigid. Nowadays, it's possible to use carbon plates. These can be placed underneath the insole, and they have the advantage of being transferable across many pairs of shoes. By using a thin carbon inlay, you get to try the device inside the shoe and see if it works for the patient. In addition, it's good to put in a rocker sole to the shoe to aid in toe off. A more conservative approach is to use a reversed Morton's, which essentially takes a channel out underneath the first all the way to the distal tip of the hallux. This allows the first to float a little more, and as a result transfers weight over to the second and third metatarsals. It is a mild correction, and it only works for some of the cases. This table is a quick guide to the choices that you can make when treating Mortons. For further information, go to hersco.com and click on the Education tab. There's an article there entitled Morton's Toe. Thank you for watching Hersco Online.